You wake up in the morning, your alarm has gone off, and as you reach over to turn it off, something feels different. Your hand feels heavy, your fingers feel thick. You try to make a fist and your knuckles resist you. You look down at your hand in the early morning light and you notice it. Your fingers look puffy. The skin on the back of your hand looks stretched and shiny. Maybe your ring, the one you have been wearing for 20 years, feels tighter than it should. And then the moment passes. You shake your hand out, you get up, you go to the bathroom, you make your coffee, and by mid-morning the puffiness is mostly gone, so you forget about it, and tomorrow morning it happens again. I am here to tell you today that what I just described is not something to shake out and forget. It is not sleeping in a strange position. It is not the heat. It is not age. What I just described is one of the earliest visible warning signals that your kidneys may be under stress. And the reason almost nobody catches it early is exactly this. By mid-morning, it is mostly gone. So people dismiss it. They accept it as normal. And meanwhile, the underlying condition that is producing that symptom quietly continues to progress. My name is Dr. Annal Mandel. I have been practicing medicine for over 2 decades, and in my experience, morning swelling in the hands and face, what we call peripheral edema, is one of the most consistently overlooked early signs of kidney stress that I see in my patients. Not because it is hard to notice, but because people have been told or have assumed that it is harmless, that it is temporary, that it is just part of getting older after 60. And I want to change that today. I want to give you the information that helps you understand what your body is actually telling you so that you can make the right decisions and get the right answers before a manageable situation becomes a serious one. If you are not yet subscribed to this channel, please do that right now before we go any further. I release content like this every week, the kind of health conversations that matter for your life after 60 and that most people never hear in a standard 10-minute doctor's appointment. Now, before I walk you through the 5 specific morning hand signs I want you to be aware of, let me explain something that most people genuinely do not understand about the kidneys, because until you understand what these organs actually do, the warning signs will not make complete sense. Your kidneys are 2 bean-shaped organs, each roughly the size of your fist, sitting on either side of your spine just below your rib cage. Every single day, they filter approximately 200 liters of blood. They remove waste products. They eliminate excess fluid. They regulate your body's electrolyte balance, your sodium and potassium levels, your blood pressure, and the production of red blood cells. They are doing all of this continuously, silently, without you ever having to think about it. And here is the critical thing that most people do not know. The kidneys are the primary controllers of fluid balance in your body. When they are functioning properly, they remove exactly the right amount of fluid from your blood, send it to your bladder, and eliminate it. When they are under stress, when they are damaged, inflamed, or working below their optimal capacity, that fluid balance breaks down. The kidneys retain sodium and water that they should be eliminating. That excess fluid has to go somewhere, and it accumulates in the body's soft tissues. According to the American Kidney Fund, edema, which is the medical term for this fluid accumulation in soft tissue, is a documented common symptom of kidney disease. The fluid builds up in the blood vessels and causes the capillaries to leak fluid into surrounding tissues. And according to research published in the NCBI Bookshelf Review on peripheral edema, this fluid accumulation becomes clinically visible, meaning you can actually see it with your eyes, once the interstitial space contains approximately 2.5 to 3 liters of excess fluid. Now here is why the morning matters specifically. During the day, when you are upright and moving, gravity pulls fluid down to your feet and ankles. That is why many people with kidney issues notice swelling in their legs and feet during the day. But during sleep, when you are lying flat for 6 to 8 hours, gravity is no longer pulling fluid downward. The fluid redistributes throughout your body. It moves to your face. It moves to your hands. And when you wake up in the morning after lying flat all night, the swelling in your hands and around your eyes is often at its most visible. This is exactly why the Texas Kidney Institute emphasizes that hands and face swelling, particularly in the morning, is one of the most specific early signs of kidney-related fluid retention. Because this morning redistribution pattern, swollen hands in the morning that partially improve by afternoon, is a physiological fingerprint of kidney involvement in fluid regulation, and it is one that too many people dismiss as harmless. Let me tell you about a patient I will call Carol. She was 63 years old when she came to see me for what she described as a general wellness checkup. During our conversation, she mentioned almost as an aside that her rings had been feeling tight every morning for about 8 months. She had tried taking them off at night. That helped a little. But every morning the same thing: puffy fingers, tight rings. And some mornings she noticed a slight puffiness around her eyes as well. By noon it was mostly gone, so she had not thought much of it. When we ran a comprehensive metabolic panel and a urinalysis, her results showed reduced kidney filtration function and protein in her urine, a sign called proteinuria that indicates the kidneys are losing the protein albumin that is supposed to stay in the blood. Carol's morning hand swelling was not age. It was not her sleeping position. It was her kidneys telling her every single morning for 8 months that something needed attention. We caught it at a stage where lifestyle changes and monitoring could make a meaningful difference. That window matters enormously. Now let me walk you through the 5 specific morning hand signs I want you to know about. And for each one, I am going to tell you what most people think it is, what it may actually indicate, and what you should do about it. The first sign is what I call the tight ring phenomenon. You put your rings on in the evening and they fit perfectly. But in the morning, especially before you have been up and moving for an hour, they feel noticeably tighter. You might have to pull a little harder to remove them. You might have started taking them off at night to avoid them feeling uncomfortable in the morning. Most people attribute this to eating something salty the night before, or to the summer heat, or simply to age-related changes in their hands. And sometimes those explanations are correct. But when this symptom is persistent, meaning it happens most mornings regardless of what you ate or the weather, and when it has been present for more than a few weeks, it deserves a closer look. According to the Texas Kidney Institute, hands and fingers are a documented location where kidney-related fluid retention becomes visible, specifically with rings feeling tight and hands appearing puffy, especially in the morning. The mechanism is exactly what I described earlier. The kidneys are not efficiently eliminating excess fluid and sodium overnight. That fluid redistributes to your hands during sleep, and you wake up with measurably more fluid in your hand tissue than you went to bed with. This is not cosmetic. It is physiological, and it is your body's way of showing you, visibly and physically, that a process is happening beneath the surface that needs attention. The second sign is pitting edema on the back of the hand or fingers. This is the most important physical test you can do yourself at home, and it takes less than 5 seconds. Take your thumb and press it firmly into the back of your hand or the side of a finger. Hold it there for 5 seconds. Then release. If the skin springs back immediately and there is no visible indentation, that is normal. But if a small dent or pit remains in the skin for 2 or more seconds after you release pressure, that is what doctors call pitting edema. According to the NCBI bookshelf review on peripheral edema, pitting edema in the hands is a specific clinical finding that indicates excess interstitial fluid, meaning fluid that is leaked out of the blood vessels into the surrounding tissue. When this is found in the hands, particularly in the morning after lying flat, it is a sign that your kidneys may not be removing sodium and water efficiently enough. The American Kidney Fund specifically identifies pitting edema as a key sign of kidney disease, noting that when the kidneys are too damaged to remove all the sodium and water from the blood, these substances build up in the blood vessels and cause the capillaries to leak fluid into the tissues. I want to pause here for a moment. If you have just done that 5-second pitting test on your own hand and you found that a dent remained, I want you to take that seriously, not to panic, but to take it seriously. Write down what you found, note how long the indentation stayed, and make an appointment with your doctor to discuss it. You now have a specific observation to bring to them, and that is exactly the kind of information that leads to early detection. The third sign is morning stiffness and reduced flexibility in the finger joints. You wake up, you try to open and close your hand, and your fingers feel stiff, resistant, almost as if the joints need to be warmed up before they will cooperate. Now, finger joint stiffness is also a feature of rheumatoid arthritis, which is why this particular sign is often misattributed. But there is an important distinction. In rheumatoid arthritis, the stiffness is typically accompanied by warmth, redness, and tenderness directly in the joints. In kidney-related edema, the stiffness is caused by fluid pressure on the joints and surrounding tissue, not by joint inflammation itself. The National Kidney Foundation documents that hand swelling from fluid retention causes difficulty bending the joints and difficulty completing fine motor tasks, specifically due to excess water accumulation in and around the hand structures. If your morning finger stiffness is consistent, if your joints do not appear red or particularly tender to the touch, and if the stiffness tends to resolve as the morning progresses and the fluid redistributes, this pattern is more consistent with fluid-related edema than with inflammatory joint disease. The distinction matters because the appropriate response is different. And a comprehensive metabolic panel from your doctor can help clarify whether kidney function is contributing to what you are experiencing. The fourth sign is shiny or stretched-looking skin on the back of the hands. When excess fluid accumulates in the tissue of your hands, the skin is stretched from the inside by the fluid pressure beneath it. This gives the skin a tighter, shinier appearance than normal, particularly over the knuckles and on the back of the hand. The skin may also feel firmer to the touch than usual. It may feel warm. According to the NCBI Informed Health Review on edema, skin that appears shiny and taut over swollen areas is a documented physical sign of edema, alongside the skin feeling warm and tight around the affected area. This sign is particularly important because, unlike the puffiness that is easy to see, the skin texture change can be subtle enough to miss unless you are specifically looking for it. But once you know what to look for, it becomes very apparent. Take both hands and compare them side by side in the morning light. Run your finger gently over the back of each hand. If the skin feels smoother, tighter, or slightly shinier than you would expect, and if this is consistent from morning to morning, please bring it to your doctor's attention. The fifth sign is the combination of morning hand swelling alongside foamy or bubbly urine. I want to discuss this one carefully because it requires you to pay attention to something you might not normally notice. If you go to the bathroom in the morning and you observe that your urine appears notably foamy or bubbly, with foam that does not quickly dissipate the way normal bubbles do, this may indicate the presence of protein in the urine, a condition called proteinuria. Healthy kidneys are supposed to keep protein, particularly albumin, inside the blood. When the kidneys are damaged or stressed, they begin to allow protein to leak through into the urine. The presence of protein in urine creates foam when it hits the water in the toilet. According to the American Kidney Fund, the loss of too much protein in the urine, which is called nephrotic syndrome, is a kidney condition that causes swelling, especially in the face, legs, and around the eyes. And when proteinuria exists alongside visible morning hand swelling, the combination is a specific pattern that nephrologists are specifically trained to look for. I want to be clear about something. Any one of these 5 signs in isolation may have a benign explanation. A single morning of puffy fingers after eating very salty food the night before does not require urgent action. What does require attention is persistence, meaning any of these signs occurring consistently over 2 or more weeks. What also requires attention is combination, meaning 2 or more of these signs occurring together. And what requires immediate medical attention is rapid onset, meaning swelling that appears suddenly, is severe, or is accompanied by difficulty breathing, chest pain, or a sudden significant increase in body weight over 1 to 2 days. Now let me give you 6 protective daily habits that are specifically supported by the research I have cited today, and that you can begin implementing starting right now. Habit 1. Do the 5-second pitting test on your hand every single morning. Just 5 seconds. Press your thumb into the back of your hand, hold for 5 seconds, release, and observe. Make it part of your morning routine alongside brushing your teeth. If you begin to notice a consistent pitting response, document it with the date and contact your doctor. This is the simplest and most actionable kidney monitoring habit you can develop at no cost. Habit 2. Reduce your sodium intake to under 2,000 milligrams per day. According to the National Kidney Foundation and the American Kidney Fund, dietary sodium restriction is one of the most directly effective interventions for managing fluid retention related to kidney function. Sodium causes the body to retain water. Excess water accumulates in soft tissue. Reducing sodium gives your kidneys less fluid to struggle with. Read nutrition labels. Avoid processed foods, canned soups, and restaurant meals where sodium content is very high. Cook with herbs and spices instead of salt. Habit 3. Hydrate consistently throughout the day with plain water, not concentrated juice, not caffeinated beverages, not sodium-heavy sports drinks. There is a common misconception that if you are already retaining fluid, drinking more water will make it worse. The opposite is actually true for most people. When your body is chronically mildly dehydrated, it retains more fluid as a protective mechanism. Proper consistent hydration tells your body that fluid is available and supports kidney filtration function. Aim for 6 to 8 glasses of plain water spread throughout the day. Habit 4. Get your blood pressure checked regularly and keep a written log of your readings. High blood pressure is both a cause and a consequence of kidney disease. According to research published in Nephrology Dialysis Transplantation in 2023, hypertension is very common in people with chronic kidney disease and remains often poorly controlled. High blood pressure damages the small blood vessels in the kidneys over time, impairing their ability to filter fluid and waste. And damaged kidneys allow fluid to accumulate, which in turn raises blood pressure further. Monitoring your blood pressure at home gives you and your doctor early warning of this cycle beginning. Habit 5. Ask your doctor to check your kidney function with a comprehensive metabolic panel and a urinalysis at your next visit. These are simple, routine, widely available blood and urine tests. The metabolic panel includes creatinine and estimated glomerular filtration rate, which measure how efficiently your kidneys are filtering. The urinalysis checks for protein in the urine, which is an early marker of kidney stress. According to the U.S. Renal Data System annual report published in the American Journal of Kidney Disease in March 2023, chronic kidney disease affects more than 10% of the global adult population, and the majority are undiagnosed in early stages because they have not been specifically tested. Asking for this test is something you can do at your very next appointment, and it could be one of the most important things you do for your long-term health this year. Habit 6. If you smoke, stopping is one of the most powerful single actions you can take for kidney health. Smoking damages blood vessels throughout the body, including those that supply the kidneys with blood flow. It accelerates the progression of existing kidney disease and significantly increases the risk of developing it. I understand that stopping smoking is not simple, but I would be doing you a disservice if I shared a list of protective kidney habits and did not include the single most impactful one. Please discuss cessation support options with your doctor if this is relevant to you. I want to take a moment before I close to speak directly to you, not as a physician giving a health lecture, but as someone who has sat with patients who came to me saying they had been noticing something for months, sometimes years, and had convinced themselves it was nothing, who had dismissed their body's signals because nobody had ever told them what those signals meant. Your kidneys have no pain receptors. They cannot produce the kind of sharp, obvious pain that makes you pick up the phone and call your doctor. What they can do is communicate through your body, through changes in how your hands look in the morning, through the way your rings fit, through the foam in your toilet bowl, through a fatigue that does not fully lift no matter how much you sleep. These are quiet signals, but they are real and they are specific. And now you know what they mean. The kidneys are extraordinary organs. They filter the equivalent of a swimming pool worth of blood every week. They work without rest, without complaint, and without asking for anything in return except a reasonable environment to function in. What they ask for is not complicated. Lower sodium, consistent hydration, blood pressure management, a doctor who checks their function periodically with a routine blood test. That is all. And in exchange, they protect you from fluid accumulation, toxin buildup, hormonal imbalance, and a cascade of cardiovascular complications that follow when they begin to fail silently. If you found this video useful, please share it with someone you care about, a parent, a sibling, a friend who has mentioned their rings feel tight in the morning but never thought anything of it. You might be handing them the piece of information that leads them to a test that changes the course of their health. That is not an exaggeration. That is how early detection works. It starts with someone paying attention and then telling someone else what to look for. Subscribe to this channel if you have not already. I post every single week on topics like this one, the health information that matters for your life after 50, and that deserves more than a 2-minute conversation at the end of a busy appointment. Turn on the notification bell so you never miss a video.